everyone. Today we are going to talk about Chapter 7, Tracking the Multiple Pathways of Parent and Family Influence on Disruptive Behavior Disorders. Our objectives are to characterize disruptive behavior disorders, explain how a gene-environment interplay affects the parent's influence on disruptive behavior disorders, describe the 5 parental influences on disruptive behavior disorders, and understand the focus of next generation of research on parenting. So let's talk about characterizing disruptive behavior, specifically antisocial behavior. Antisocial behavior that's associated with psychopathy has a higher irritability rate, and the people who have this have poorer outcomes than without psychopathy. Antisocial behavior with ADHD involves a stronger genetic component than without the comorbidity of ADHD. And the COMT gene is not associated with either antisocial behavior or ADHD, but it's found in individuals who have both disorders. Life course antisocial behavior is more associated with family dysfunction, whereas maternal anxiety, harsh parenting are associated with life course behavior problems. There's a multisystem transactional developmental process of effects. So there's some parental characteristics that are important. Conflict and hostility in parental marriage and divorce play a high role in disruptive behavior disorders. And there's actually a higher association with disruptive behavior disorders for families who have a high amount of family discord as opposed to those who have separation. So that old adage of staying together for the kids does not hold true. If you are together just for the kids, but there's a lot of family discord, it actually has worse outcomes than if people just separated. There are some differences for males. Males are more susceptible to neurodevelopmental impairment than family influences. So theirs are going to be more biological and structural as opposed to family influences in the cause of disruptive behavior disorders. Discipline is also important. There's an association between aggression and physical punishment and disruptive behavior disorders, but it only holds true for those children who are white. It actually does not hold true for those children who are African American. Family closeness also is kind of interesting. There's an emphasis on family closeness often in Latino families, and that emphasis for family closeness is actually a risk factor for Latino males for developing disruptive behavior disorders. It's the opposite effect of African American males, so that family closeness and responsibility emphasis actually decreases the likelihood of African American males having disruptive behavior disorders. Multisystem transactional process just means there's a lot of things that interplay and could cause disruptive behavior disorders, including culture, society, socioeconomic status, the neighborhood children grew up in, their ethnicity, political power, we've seen a lot of that this year, exposure to discrimination, the role of extended family, how often the parents work, access to health care, the level of education and the quality of education. These all play a role in the development of disruptive behavior disorders. There's diverse family influence process. There's multiple aspects of the child-parent relationship that can either increase or moderate the risk for the development of disruptive behavior disorders. Approaches is important. The development of disruptive behavior disorders is linked to parenting approaches, including responsiveness or sensitivity to the child's needs, communication, how protective a parent is, the level of controlling behavior that a parent has, the guided learning that a parent provides, and the quality of their relationship. The levels of parenting influence are also important. So there's a couple of different ways that parents can interact. They can be interactive partners. They can be director or instructor and manager of child behavior, or they can be a provider of developmental opportunities or the shaper of context. So they talk about these specific levels of parenting, but the book doesn't really go into detail as to which one decreases or increases the risk of disruptive behavior disorders. And there's other influences that we've talked about in previous chapters. Prenatal exposure to teratogens such as alcohol and drugs, the level of maternal stress, parental psychopathology, and abuse or neglect. These are all factors that deal with the family or parents that also have some influence on the development of disruptive behavior disorders. We're going to go back to Chapter 2, applying a gene-environment interplay perspective. So let's recap. Genes, through epigenetics, which is the heritable change in gene expression, where the behavior changes but not the actual DNA, influences gene expression. In terms of gene-environment correlation, rearing has a genetic mediation, which means that the behavior shares a pathway with both the environment and genes. A gene-environment interaction, so we've talked earlier about a variant of the MAOA gene moderates the effect of child abuse on antisocial behavior, and when the gene is present, the child abuse is a negligible risk, so it decreases the likelihood of disruptive behavior disorders occurring because of that. Parents have a lot of genetic influence on their children. There is an influence of risk through the genetic and environmental transmission as shared traits or tendencies, or as products of between family members. There's a genetic liability because the parent could have antisocial behavior. They could have a genetic liability from the parenting tendencies, so tendencies to maybe have some harsh discipline. They could have genetic liability from the reaction to the parenting tendencies. So we've talked previously about how parents react negatively to their children, children react to that, and then parents react further to that. There's liability from genetic behavioral tendencies toward maladaptive reactions or sensitivity to the environment. And one study found that genetics play a factor, but environmental factors play a stronger role. DRD2 is a dopamine receptor allele that's related to lower parental sensitivity in children. So they also found that this was found in the children of those parents. It's related to less responsive children and less positive behavior in children, as well as lower parental sensitivity. And they found less sensitive responding by parents when they had that dopamine receptor allele. Genetic liabilities and environmental factors, parental adjustment to the child's capabilities and needs, monitoring, predictable and consistent discipline, emotional warmth, support, economic and social resource, and stress are all liabilities that could negatively or positively affect the development of disruptive behavior disorders. And there is a critical age. Between the age of 5 and 7 is when children learn the predictability of their resources, the trustworthiness of others, and they understand how close relationships are formed. So if that doesn't happen during that critical age, then it promotes the development of disruptive behavior disorders. So the book then goes on to talk about 6 parenting practices that organize parental influences, but if you read, there's actually only 5. So we're going to talk about those 5, and I'm not really sure what the 6th one is. The first one is attachment relationships. An attachment is just whether or not you have a figure that you are bonded to. Attachment security was a poor predictor of adult functioning, but social relationships did predict adult functioning. The main risk... Sorry, as I said, no matter where I go, I can't find some place that's quiet. As I was saying, the main risk comes from a combination of attachment insecurity, family adversity, and ineffective parenting, and it has a greater effect on boys. Disorganized attachment, and disorganized attachment is often the result of neglect or abuse, has a strong association with child psychopathology, but it's not deterministic. So it means that the child might have some type of psychopathology, but it doesn't necessarily mean that the child is going to develop disruptive behavior disorders. And the risk is not diagnosis specific. So they can't say that because the child has an insecure attachment, this is the specific disorder that they're going to develop. The studies also have not been longitudinal, so a definitive link is hard to establish as to what type of insecure attachment, and there's 3. There's disorganized, there's avoidant, and ambivalent. Which one of those actually has a specific link to disruptive behavior disorders? Discipline methods. There's an assumption that discipline is consistent in both rules and expectations, and it's in proportion, I can speak, to the offense that's committed. The type is also important. Physical punishment, psychological coercion, positive supportive comments. Parents are more negative as a reaction to a child's negative behavior. And as we know, maltreatment has a strong adverse effect on children. They found that corporal punishment arose in response to the child's behavior. It wasn't the cause of the child's behavior, but frequent corporal punishment often leads to maltreatment. Physical punishment has a correlation to disruptive behavior disorder, as it often exacerbates antisocial behavior, especially when that physical punishment is inconsistent, harsh, and delayed. Physical punishment results in less internalization of moral lessons, less self-control, and more emphatic responses. So the child is more emotional when they respond. Physical punishment may result in immediate complying, but it results in a defensive and combative response that grows into antisocial behavior. African American parents are more likely to use physical punishment, make hostile attributions about their child's behavior, and fear that their child's behavior is going to lead to long-term problems. But their use of physical punishment is less strongly correlated with antisocial behavior. And that's a paradoxical effect that's cross-culturally. Those who use physical punishment the most have the most or the littlest adverse effect on it. So it affects them the least as opposed to, for example, white children. Coercive interaction model, consistent rules and parental response to child resistance results in fewer attempts at control by parents. So if a child is constantly resisting the parent's attempts to parent and set guidelines and rules, it promotes misbehavior through negative reinforcement because the parents just give up. So that negative reinforcement, something that's aversive, that punishment is removed and it makes the behavior more likely to occur. The coercive interaction model is characterized by abrupt and intrusive parenting rather than corrective guidance, and it evokes resistance and emotionally charged exchanges. It's labeled a coercive exchange, and it includes the parent's hostile attributions about the motivations and noncompliance. This then spurs greater parental control that strains the parental capabilities. That includes the type of parental response as well as the level of response, and inconsistencies often increase the behavior of the child. So as we can see, it's just this negative cycle that keeps going around. So the parent tries to parent, it results in behaviors from the children. The behaviors from the children make the parents less likely to parent, and it just goes on and on. Monitoring of child safety and well-being is important. It's correlated to the disruptive behavior disorders. This includes parental attention to and knowledge of behavior, knowledge of their social relations, motivation, safety, direct interaction, and attention to peer relationships. Some studies say that there is no relationship between the monitoring of child safety and well-being and disruptive behavior disorders, and others say that it's more important in childhood than in infancy or adolescence. Parental actions to monitor the child's whereabouts and obtain knowledge of activities is consistently predicted less antisocial behavior. So if parents are more involved, then their children are less likely to develop disruptive behavior disorders. And that is very true. The measurement should take into account the developmental needs. So safety and constant awareness is going to be important in infancy. That's not going to be as important in adolescence. The child within sound is going to be important when there's a toddler, and knowing the whereabouts and who the friends are is going to be important in adolescence. Warmth and hostility, a positive receptivity towards a child's needs and tendencies, and a positive disposition toward the child, the absence or the low rate of discipline that relies on threat, disparagement, or rejection, or forms of emotionally abusive interpersonal interactions decrease the likelihood of disruptive behavior disorders. Warmth moderates the risk for antisocial behavior due to physical punishment. So if a parent physically punishes their child, but they still show warmth, it's going to decrease the likelihood of disruptive behavior disorders. Parental warmth is related to when coercive parenting is most harmful. So if you have coercive parenting and little parental warmth, it is more likely going to result in a disruptive behavior disorder. The effect of parental negativity on antisocial behavior increased as antisocial behavior increased. So as children tended to increase in their antisocial behavior, parents' negativity toward them increased and then thus caused an additional increase in antisocial behavior. Warmth did not moderate the genetic and shared environmental contribution to antisocial behavior. Parental warmth did mediate parental violence in relation to youth violence. One study found that those who exhibit more aggression evoked more parental hostility, and that parental hostility then increased disruptive behavior disorders. So that makes sense. If you have a hostile parent, you're going to have more likely a disruptive behavior disorder. Maternal hostility levels are also related to externalizing behaviors. Maintaining cohesion in the face of stress. So cohesion is defined as the ability to maintain an emotional connection among family members in the face of stress and conflict. It includes more positive and cordial family relationships that promote well-being and constructive problem solving during conflict. Family systems focus looks at the family as the essential unit of interest. Parental conflict led to externalizing behaviors, while rumination about that conflict or constantly thinking about it led to internalizing behaviors. This causes a decreasing security and increasing affective and cognitive stress, and a lessening of soothing parental responses that teach self-control. So if a parent isn't there to soothe us, if we're constantly upset, then we're not going to learn that self-control. Family cohesion in preschool predicted increased pro-social interactions in middle school, so those actions of being nice just to be nice, of being friendly. A lack of cohesion has been linked to disruptive behavior disorders. Children in the least cohesive families had the highest number of problems, and family cohesion does moderate the family stress on risk. So next we're going to look at advancing knowledge about family influence processes and talk about their research needs. We need a research design that can determine which family influences have a basic role, which augment primary influences, and those that are derivative or have no influence. So the way that we do this is through interventions. Interventions are teaching parents to use timeouts and the importance of consistency. These had a larger effect than interventions that taught parent problem-solving skills or how to promote cognitive, academic, or social skills. So timeout is a very effective tool, but most parents don't use it correctly. So timeout is an example of negative punishment. Negative because you're taking something away, you're taking away that attention. And it's punishment because taking away that attention is supposed to decrease the likelihood of the behavior coming. Well, if you're taking away that attention, you literally have to take away that attention. But if we think about it, little kids will sit in the corner and then they'll get up and the parents will be like, no, honey, you got to go back in time out. Your time's not up yet. So they're giving them that attention, so it's not effective. Mediation analysis is going to be important as well. This is a study that explains the relationship between family influences and disruptive behavior disorder by looking at one variable's influence on another through a mediator variable. So, for example, if we're looking at discipline and the cause of disruptive behavior disorders, the mediator might be the type of discipline. So whether it's positive reinforcement, negative reinforcement, positive punishment, negative punishment, if it's physical punishment, if it's corporal punishment. the specific research needs, we need to have research that starts with an empirically supported mediator and a process that's ruled out alternative processes. We have to have research that is consistent across replications, so it has to be sound enough in its methodology to be repeated and get the same results. We have to have experimental tests that manipulate the mediator to determine the effects of child outcome. We have to have an establishment of a timeline between the mediating and mediated effects. We have to also establish the plausibility of mediation in terms of a broader evidence base. So does that mediator make sense, or is there something else that might be a better influence or better explanation for it? And here's a couple of things that they really need to incorporate into the research. The first is direction bias. There's an assumption that parenting leads to problem behavior, but the alternative theory is that problem behavior leads to negative parenting practices. Most theories suggest that there is a reciprocal relationship over time, and the studies suggest that genetic factors that underlie child behaviors might also underlie the parenting behaviors. So the parent and the child might have the same underlying risk factor, and it's affecting both the child's behavior and the parent's parenting style. The difference across life course, parenting shifts as a child grows. In infancy, they really need to focus on providing food, warmth, and a secure attachment. As they're a toddler, they need to have consistent responses to misbehavior so the child learns which behaviors are acceptable and which aren't. And during adolescence, they have to monitor the child's whereabouts, supervise activities, limit access to harmful environments. So we have to look at how parenting over time affects child behaviors and vice versa, how child behaviors over time affects parenting. Fathers in new family configurations, 40% of births are to single mothers. Fathers remain involved in the child life even if they're not living with them, and these living arrangements affect fathering and its impact. The separation from the mothers means that there's probably a different parenting style, and the separation may mediate the harsh parenting practices of one parent. Parenting in context is also important. Parenting in context includes the cultural, ethnic, and national norms, the role of extended family, and neighborhood ties, and how parenting looks in those contexts. It alters which parenting styles are possible or at least plausible. So money may prevent parents from staying home. So they might not be able to have a stay-at-home parent. Most parents might work, and they both might work long hours. They might live in an unsafe neighborhood, and that may limit the independence and the exploration. That's an optimal parenting practice. They can't have their child do that because it's unsafe. Alters the meaning of parental behavior. Culture and ethnic groups influence parenting. High family involvement is a risk factor for delinquency in Latino men, but it's a mediator for risk factor in African American men. Praising teens in front of friends often leads to the opposite behavior. So if a parent praises them for doing something, they don't want to look stupid in front of their friends, so they actually go to the extreme and do the opposite. And new information technology. Monitoring and supervision of adolescents is critical to prevent antisocial behavior, and parents are better able to monitor children, but children have a wider access and exposure to social situations. So if they have an iPhone, for example, there's the Locate My iPhone where they can track where their child is. The internet could provide parents with supports and strategies which may make their parenting better. And then we have to look at parenting interventions. Intervention studies have to be tied to the gene environment modeling of risk, and technology will improve the quality of studies and the information gained. I will see you guys for next week's lecture, which is the last one.